Does TBI Imaging Associates treat TBI? What can I do to help my patient client improve?
No, we do not. What we specialize in is facilitating either the presence or absence, identifying, getting the answer, whether there's traumatic brain injury present or not. We can help do that by our highly specialized DTI scanning, which we do all across the country at current count 32 imaging affiliates in multiple states across the country. But we do not treat patients for traumatic brain injury. There's other types of specialties, usually physicians, usually neurologists, who can help with that. That being said, we've seen many patients who are unfortunate victims of trauma. They have traumatic brain injury, and we empathize with them. Overwhelmingly, these patients don't care about compensation or legal matters. They just want to go back in time, and they want their accident not to happen, and they want their brains back, and they want their lives back. And that resonates with us. Unfortunately, we don't have a time machine, but we do have one tool in our armamentarium, and this is what we'd recommend: intense neuro rehab. Neuro rehabilitative exercises are critical, particularly in that first 12 months or so after injury. So you see, the brain has something called neuroplasticity. When we're young, when we're infants and we're children, the brain has a high degree of neuroplasticity. What does that mean? It's forming connections. It's primed to learn new things. And all of that learning new things represent connections in the brain. And as you grow and you learn more, you see sights and sounds and images and read and knowledge and solve problems, you form those connections. And the brain has a high degree of neuroplasticity in childhood and in youth. And that slowly, generally, all other factors equal, decreases over time. We've all heard the adage, old dog, new tricks. There's a little bit of truth to that from a physiological standpoint. It's not that older people can't learn, they can, but it is a little bit harder. So as an aside, this is why it's very important for all of us and for everyone to constantly learn, constantly stimulate our brain as we grow older. That will prevent aging of our brains and keep us more healthy and vivacious. I digress. Neuroplasticity, generally, it's highest in infancy and childhood, and then gradually all other factors equal starts to decline with age. And the ability to form those new connections and learn becomes a little bit harder. That being said, the brain and the body are somewhat unforgiving. When one undergoes traumatic brain injury after an accident, the brain sort of recognizes that. This is the miracle of the human body. And they open up, and the brain opens up a temporary time period of slightly increased neuroplasticity. And that lasts about 12 months. It's not an exact science. About 12 months after the injury, the brain has more neuroplasticity during that time window. So neuro rehab exercises are critically important. The more the better during that first 12 months after the injury. So we have a nice PDF that lists the 5 leading neuro rehab exercises websites. A few off the top of my head are Luminosity, Brain HQ, Happy Neuron. These are very much brain teasers, cognitive problems, like some of us used to do in school and when we were in elementary school in the gifted and talented programs. It may sound like a game, it's not. This is exactly what the brain needs to do. Just like the body, if you injure your shoulder, you have to do rehab with a physical therapist after to get the strength back and get the functionality back. The brain is the same way. The brain is the same way, and its exercises are these neuro rehab exercises from some of these websites I just mentioned. If you want to contact us, we'll send you this PDF with the top neuro rehab websites. They have free trials or low-cost paid subscriptions, but we'd strongly encourage all accident victims who suffer from traumatic brain injury, all attorneys who work with accident victims who suffer from traumatic brain injury, to strongly recommend as much neuro rehab from these neuro rehab websites as possible, particularly within that first 12 months where neuroplasticity is heightened. No guarantees. The brain is a complex machine, so is the body. Will the accident victim, will the patient client get 100% back to normal? We certainly hope so. We don't know. But we do know that the more rehab is done, the more neuro rehab, the better they will be.